Aesthetic surgery is often used as a solution to people's misperception of their physical appearance as well as psychological issues dealing with their self-image. But people fail to understand the negative psychological effects plastic surgery has on patients. In most cases, patients develop depression and report high levels of anxiety post-surgery, which can later lead to deeper psychological illnesses like physical dysmorphic disorder. Plastic surgery procedures date as far back as 800 BC. According to the American Association of Plastic Surgeons, aesthetic surgery was mainly used for the treatment of war-related injuries, and it wasn't until the late 1990s when through new technological advances and the exposure of people to the media when plastic surgery took more of a cosmetic approach. Aesthetic procedures are now used not to improve the quality of life of the patient, but to fix and modify the individual's physical appearance in hopes of reaching perfection. This increase is linked to the growth of mass and social media and the exposure people has to it. J. Walker Smith, executive chairman of the Futures Company, stated that an average person can be exposed to up to 5,000 ads and spend 3 hours on social networks per day. The psychological impact media has on people is impressive. After being constantly reminded through ads and campaigns what the idea of beauty and perfection is for society, people develop insecurities and seek help from plastic surgery to achieve a better self-body image. Social media also plays an important role. In fact, 31% of doctors polled by the American Academy of Plastic and Reconstructive Surgery said people cited social media as the reason why they decided to get surgery. Through Facebook, Instagram, Twitter, and other social networks, pictures are constantly being shared and exposed, allowing people to overanalyze their appearance, and it provides a platform to compare themselves to the beauty stereotype society has. How many plastic surgery procedures have you gone through?
I've gone through 3 plastic surgeries.
What were the procedures you have done yourself?
The first one was clipectomy, liposuction, and breast implants.
Why did you decide to get plastic surgery?
I decided to do the plastic surgery to look better because I wanted to please my husband. Also because I was tired of looking everywhere, like everywhere you see there's like the perfect body. You go to a restaurant and you see people with, beautiful, perfect breasts, small waist, the magazines, the media, the TV, you hear on the radio, you go to the gym. Like I tried everything, I have tried everything, and to me that was my last hope.
Were you satisfied with the results and were your expectations met after the surgery?
To tell you the truth, no. I wasn't satisfied. I wanted to look natural, and they didn't look natural at all. So that's why I had to get them done again. And I wasn't satisfied either because they were too fake. They looked too fake.
And what surgery was that?
The breast implants.
How did you feel after the surgery?
After the surgery, I was depressed. It was hard. The results are not immediate. I went through a lot. I suffered from depression. That led to anxiety attacks. I was on treatment for 6 months, and to tell you the truth, I wouldn't go through that again.
Did you think you were going to be happier after the surgeries?
Yes.
Why do you think you ended up in a depression instead of being happier?
Because I really thought I was going to end up looking much better than I imagined. The results weren't what I expected. I ended up looking, to tell the truth, worse. The scars, the pain, the sensation.
People think that plastic surgery is a solution for their physical and psychological problems. They think that after going through certain procedures, their life will instantly change, but they usually hold unrealistic expectations and they fail to understand the psychological risks that come with cosmetic surgery. According to the American Psychological Association, patients often experience depression, adjustment problems, social isolation, higher anxiety levels, and/or self-destructive behaviors. A study conducted by Cambridge University determined symptoms of depression and anxiety had an odds ratio of 1.66, 2.88 for self-harm, 3.29 for para-suicide, and 2.46 for illicit drug use. Another important and serious disorder is BDD, or body dysmorphic disorder. This is an axis 1 disorder characterized by an individual's intense preoccupation with an imagined defect in appearance, which makes the individual experience significant distress and functional impairment. According to Dr. Randy A. Sansom from Wright State University, BDD is 7 to 15% more prevalent in plastic surgery patients. The APA states that patients do not experience improvement in their BDD symptoms after surgery, often asking for multiple procedures on the same body parts, putting the patient's life at stake. Awareness must be created in order to better prepare people planning to have any cosmetic plastic surgery procedure done by making more information available. Patients must understand what the surgery will really do for them and must be analyzed more deeply by a psychologist before being approved to undergo any kind of procedure to determine if the person is mentally suitable. Furthermore, surgeons should make it a norm to have the patients follow a treatment after surgery with a psychologist to help them cope and adjust to the new physical changes.